everybody, and thank you so much for coming to the festival and for coming to our first bilingual talk. It's my pleasure to introduce Rosa Solorzano, and Rosa's talk today is Jobs and Healthcare Related to STEM, Minority Opportunities in Healthcare.
Hola, buenos días, gracias por venir. Ella es Rosa Solorzano y ella está aquí para hablarles sobre trabajos en el field de medicina. Y STEM significa ciencias, tecnología, ingeniería y matemáticas. Y ella va a estar trabajando, ella les va a estar diciendo diferentes oportunidades en este field.
So welcome everybody. My name's Rosa Solorzano and I'm from Yakima Regional Human Resources, and I'm just here to talk to you a little bit about how the STEM program correlates with healthcare and healthcare jobs. Is everybody in the room, are you all English and Spanish speaking, or? Yeah. All English? Yeah. Okay. All right, let's get started. So just to give you a little bit of background in regards to the Hispanic population here in Yakima, we do consist of about 33.7% of Hispanic ethnic origin, and only less than 10% of the Hispanic population is actually involved in any healthcare positions. And these statistics are according to the 2000 U.S. Census Bureau. Some examples of healthcare opportunities would consist of doctors, which would be called physicians, registered nurses, anyone in the lab, which would be in either microbiology, pathology, or clinical laboratory. We also have employees that work in the radiology department, whether they're X-ray technicians or ultrasound technicians, mammography technicians. We have employees in the cardiology department that specialize in working with the heart. Pharmacists, which also work in the pharmacy, pharmacy technicians. We have positions in the physical and occupational therapy department, respiratory therapists, and biochemical technicians, which these biotechnicians are the ones that actually help maintain all of our equipment that we have in any of the healthcare facilities. So they're the repair guys that will come in and fix any equipment that goes down. One example of an opportunity, if any of you are interested in going into any of the nursing fields, as you know, the RN supply is going to will keep pace with the population growth, but in reality, the RN demand is actually going to increase faster than our actual population growth. And this is simply due to the added healthcare needs of our elderly, more people that are going to become ill with chronic illnesses, and more people that will be insured. So how does science relate to healthcare? Well, science relates to healthcare in the sense, just to give you a few names as to how it relates, is we have a neurology department, oncology, which would be like chemotherapy, orthopedics, cardiology, study of the heart, rehabilitation services, therapies, and psychology. Now, as you all know, that with the increase in technology, we have converted over in the nursing field. We are now moving more towards an electronic charting system. In our clinical labs, more of the advanced technology is taking place in the testing instrumentation. In cardiology and orthopedics, the physicians are now using robots. And in the electrophysiology, the doctors are now using advanced technology to study the heart rhythm and how to correct it. Engineering, as it relates to STEM and healthcare, engineering is continuing to grow with the advances in technology. And this is where our biochemical medical technicians come into play, because they are the repair guys, again, that come in and will repair any of the equipment, the medical equipment that goes down. Now, with mathematics, as we know in healthcare, there are some quantitative and qualitative measures that support all of our areas in healthcare. And with our current healthcare system, we have a current reimbursement system that is contingent upon any of our quality measures, meaning that's how the hospital gets paid now in regards to how our patients review and give us feedback regarding their patient care. So some questions for you guys to think about is, what do you like to do? And what are you good at? All right, do you guys have any questions for me as far as healthcare goes, or how it relates to the STEM program? We have a volunteer and student coordinator in our facility that actually facilitates all of the job shadowing for students. So as long as the person is over the age of 16, we can place them with a preceptor or somebody on site that will actually job shadow them. So we do carry out the student program. I would say at least a B or an A, because they have to, I mean, especially in the science field, you have to be pretty accurate because you're dealing with patient care and the safety of, the patients. For one position, let's say for an RN opening, we probably get about 200 to 300 applications. For that one position. That's just nursing. Now, if it's a housekeeper, let's say totally on the different end, we probably get about 500 to 600 applications for that one job. Yes, you do. And it depends on what field you want to go into. So let's say, I'll just keep throwing out a registered nurse. To be a registered nurse, I mean, you have to go at least, 4 years, 2 years to do your prereqs, and then 2 years. You can continue going, though, and get your bachelor's in science and go for 4 years, or get your master's. So, I mean, there's never, the sky's the limit. You can go as far as you want. And don't be shy. If you guys have any questions, call or connect yourself with the counselor at your school. Or, if you have connections, whether it's within your community, or of a doctor that you want to shadow, or a nurse, or a friend, and maybe someday you want to be like them, don't be afraid to ask. So, other than that, if you guys don't have any questions, that concludes my presentation. Thank you.